So on the NCLEX, knowing what's wrong is only half the battle. The real challenge is choosing the next best step under pressure. Do you call the provider? Do you reassess? Do you hold medication? Do you intervene immediately? And when you only have 60 to 90 seconds per question, your brain can freeze. So today, in lesson 6, I'm going to teach you exactly how to think through a complete clinical scenario from start to finish, using the same process as nurses use at the bedside and the same model the NCLEX uses to score your decision making. This lesson brings 1 to 5 together. All righty. So this lesson is all about integration. Students struggle with the exact problem. So they struggle with recognizing the right cues, missing trends, prioritizing the wrong clients, giving unsafe medication, calling the provider too early or too late, choosing the wrong next action. So today, you'll learn a repeatable, reliable 4-step process that will work in any scenario. Fundamentals, Med-Surg, OB, Peds, Psych, it doesn't matter. And this is what it is. It's the 4-step next best step framework. So the 4-step framework. So step 1, identify the most concerning cue. Number 2, decide if the patient is stable or unstable. Number 3, match the problem to the primary framework, ABCs, safety, trends. And then number 4, perform the safest immediate action first. Before I move on, I always tell my students, once you know the most concerning cue or know the problem, the interventions in nursing, pretty much the same. Okay. So let's identify the most concerning cue. So when you look at a scenario, don't get distracted by the noise. Ask one question. What's your biggest problem? What's the biggest danger right now? So examples would be patient's respiratory rate is 8. That's respiratory depression. Potassium, 6.1. That can lead to a deadly dysrhythmia. A MAP of 58. So remember, MAP's less than 65. That's organ hypoperfusion. So a MAP of 58 is organ hypoperfusion. New confusion, and that SpO2 of 86, the patient's hypoxic. Pain 10 out of 10. That's important, but typically not always the priority. Okay, there's something else always there. So remember, not all cues weigh the same. Okay, so how do you decide stable from unstable? A stable patient is one that's predictable and have expected findings. An unstable patient, that patient's deteriorating, they're unsafe, or have some life threatening changes. So, unstable, something's new, something's sudden, something's worsening, abnormal vital signs, high risk lab values, respiratory problems, active bleeding, and a MAP less than 65. Now, your stable patient, chronic condition, expected outcomes, the patient's condition is improving, normal vital signs, and their pain is controlled. The NCLEX will always prioritize your unstable patient. So let's apply the priority framework. So your tools are ABCs, airway, breathing, circulation. Then Maslow's. Maslow's, you're always going to look at physiologic, which is more important than safety, which is more important than love and belonging, which is more important than the patient's self-esteem. Okay. You're going to look at trends. So if the respiratory rate is rising, the patient's deteriorating. If the blood pressure is falling, the patient's going into shock. If the SpO2 is falling, that's respiratory failure. If the potassium is rising, that puts the patient at a cardiac risk. So your job as a nurse is to match the main problem to the correct priority category. So what's the safest thing to do? When a patient is unstable, you pick an intervention before calling the provider. Before I start with these examples, understand when your patient is deteriorating, you need to assess quickly, get some vital signs, and then perform an intervention. So if the patient is hypoxic, please put some O2 on before calling the provider. If the patient's respiratory rate is 8 after you gave them an opioid, stop the opioid, stimulate the patient, maybe a sternal rub, give some O2. If the potassium 6.1, that patient on the cardiac monitor stat. If the patient is post-op and they're bleeding, apply pressure, stay with the patient, assess the patient, call for help. If their MAP is 58, if the fluid bolus is ordered, give the fluid bolus, raise the legs unless it's contraindicated, all right, and then call the provider. Never choose notify provider when a nursing action comes first unless the problem requires a new order. So, patient example. So, a patient, you know, MAP is less than 58. You know they're going to need a fluid bolus, but there's none ordered. Then you call a provider first, okay? But you're still going to need vital signs. You're going to still need to assess the patient. Then you call a provider and say, hey, the MAP is 58. You know, we don't have any fluid to it. All right. So let's do a scenario. 67-year-old patient with heart failure reports reports shortness of breath. Their vital signs is blood pressure 92/58, heart rate 118, respiratory rate 30, SpO2 86 on room air. They have 2 plus edema. They're sitting upright and a little anxious. The medicines you have is furosemide 40 milligrams IV, metoprolol 25 milligrams PO, and morphine 2 milligrams IV as needed. So now let's go through the steps. Step one, what is most concerning? So you got some things going on. Respiratory rate 30, SpO2 86, blood pressure 92/58. So the immediate threat, ABCs, oxygen failure. Step two, is the patient stable or unstable? Well, they're unstable. They're hypoxic, they're tachypnic, and they have some borderline hypotension. Step three, what's the priority? ABCs, breathing comes first. So this patient's in respiratory distress. Number four, what's the safest immediate action? Put on that O2. Patient needs oxygen first. Raise the head of the bed unless it's contraindicated. If the patient has the order, which they do, of the diuretic, give the diuretics after the oxygenation improves. Hold that metoprolol because the respiratory rate is already high. Oh, I'm sorry. Hold the metoprolol because the blood pressure is already low. I'm sorry. Don't give the morphine because the respiratory rate is already high and the patient's oxygenation is poor. And after you do those things, you're going to monitor your patient, notify the provider after you stabilize the airway and the breathing. Okay. So let's do some mini scenarios. I have four of them. So you have a post-op patient, blood pressure 78/50. They're pale, they're cool, they're confused. So what's your next best action? You're going to assess, post-op patient, assess the incision for bleeding, start some oxygen. The problem is that the patient's bleeding and they're going into shock. So there's a circulation emergency. Scenario two, potassium 6.2, tall T waves, complaining of palpitations. Next best step, put the patient on a cardiac monitor. Now, stat. Then prepare possibly if there's order for insulin or glucose because that's going to help bring that potassium down, help it shift back into the cells. Scenario three, respiratory rate 9 after hydromorphone. You gave the patient opioid. What's the next best step? Stop the opioid. Apply oxygen. Stimulate that patient. Call the provider only after immediate respiratory support is given. And number four, your MAP is 58 and your patient has a decreased urine output. What's the next best step? Give a fluid bolus if it's ordered. Raise the legs to improve perfusion unless it's contraindicated. So, understand the NCLEX, the NCLEX rewards the NCLEX rewards sequence. It does not reward speed. So you want the correct sequence which is always going to give you the correct answer. It's not always about answering things or doing things fast. Because students fail because they skip right to calling the provider. They forget to check vital signs. They hold the wrong medication. They miss early respiratory failure. And they don't recognize that the map is less than 65. So, as nurses, we fix what we can fix first and then escalate by calling the provider. So, here's a challenge. 55-year-old, pancreatitis, new confusion, vital signs, blood pressure 104/70, heart rate 122, respiratory rate 28, temperature 102.8, and an SpO2 of 91%. Their labs: white blood cell count 17,000, potassium 3.1, creatinine 1.7, urine output 20 milliliters per hour. You have some saline going at 125 an hour, some IV morphine, some PO potassium, acetaminophen, and you have an order to call the doctor if the heart rate is greater than 120. So what's your most concerning thing? Patient new confusion, respiratory rate of 28, elevated temp. Patient's probably septic, okay? Are they stable or unstable? They're unstable. Priority: ABCs, then infection and organ perfusion. So they have a low urine output, a rise in creatinine, and that will tell you that there's some kind of kidney injury going on. The potassium is low. That's going to put the patient at an increased risk of dysrhythmias. Number four, what's the next best step, or what's the safest? Start IV fluids, because IV fluids improves perfusion, blood pressure, kidney function, and sepsis outcome. Then you're going to give the acetaminophen. Then you're going to hold the morphine because the respiratory rate is high and there's confusion. You're going to give the potassium because the potassium is 3.1. And you're going to call the provider after initial stabilization. So, with that, we have done a full clinical judgment, identifying cues all the way to choosing the best action. You know exactly how to think, hopefully, and just watch the video again under pressure, how to avoid the traps that always causes students to fail, and how to choose the safest thing that the nurse would do. Remember, it's not all about being perfect. It's all about following a reliable process. Remember, you're becoming safe and confident, and that's what we want. We want safe, confident, competent nurses, and that's what the NCLEX is designed to protect. So that's it. So download the complete clinical judgment workbook at NurseEdScholar.com to practice more scenarios. Please like, subscribe, and hit that bell, because my next series, because this is the end, my next series is going to be pharmacology, safety, or NCLEX pharmacology made easy. Alrighty. So remember, you got this. I'm proud of you. Keep studying. Keep doing what you need to do to be the best nurse that you can be. Until next time, have a good day from Nurse Ed Scholar.